Hi, my name is Jennifer Belsky. I'm an assistant professor here at Indiana University and serve as the director of lymphoma for Riley Hospital for Children. I'm here today to talk about my new article investigating the safety and feasibility of osteopathic medicine in the pediatric oncology setting. My research started out, and really this article is based off of a needs assessment that did show that pediatric oncologists, patients, and their caregivers were very interested in having osteopathic medicine available throughout my patient's chemotherapy journey. What this article looked at was, is it feasible for a DO physician to do OMT in the outpatient setting? And what we found is yes, it is absolutely feasible, as majority of our patients were able to complete at least 80% of their visits without any issue. The next thing I really sought to investigate was, did OMT cause any adverse events to my patients? Obviously, all patients are special and fragile. However, pediatric oncology patients have an extra level of that fragility due to chemotherapy and a lot of them receiving steroids. And so what we did was investigate, were there any increase in adverse events while receiving OMT? And what we found was there was no increase in adverse events, but we did see expected things such as chemotherapy-induced anemia, thrombocytopenia, and infections that we all say most likely due to their chemotherapy. What I'm hoping that this article does is it starts to at least gleam a little bit up to the success of treating pain and constipation with OMT. Descriptively, we were able to look and show an improvement in FACES pain scores pre and post OMT. And we also were able to show that almost 100% of our patients had a bowel movement following majority of treatments. I'm hopeful that this study will lay the foundation for our next study, which is investigating what type of OMT treatment is best for pediatric oncology patients. I firmly believe it's really important to get this information into the literature. Although DOs have been doing OMT for decades, we need to get more into the literature about what techniques work, showing that they're safe in different patient populations, and possibly are we able to teach some families to do some of these easy techniques at home, especially given the new era with telemedicine. I'm hopeful that this study will show and allow more DO physicians to feel comfortable doing OMT for a lot of different patient populations, given that our patients tolerated it fairly well. I'm also hopeful that our next study will show that OMT is beneficial for pain, constipation, and can have an increase in their improvement of quality of life. I'm also hopeful that this article will spur more DO physicians to do more investigating, more evidence-based medicine, as far as just record what you're doing in your practice. Have medical students write up more case reports. Anything that can get the beauty and the benefit of OMT out into the literature, I'm all for. Thank you so much, and I hope you enjoy the article.